Welcome and thank you for standing by. At this time, all participants are in a listen-only mode until the question and answer session. To ask a question, please press star and then 1. This call is being recorded. If you have any objections, you may disconnect at this point. And now I will turn the call over to the program assistant, Ms. Bessie Chen. Ma'am, you may begin.
Hi everyone. Thank you all for joining us today for our AAPI State and Local Commissions call. I'm Bessie and I'm a program assistant with the initiative, and we also have Akhil Vora, Senior Advisor, Stephen Yim, Advisor, and interns Galunia and Darren on the call today with us. So as you know, we recently conducted a survey of your commissions to get a better understanding of how your organizations operate. We wanted to learn about your approach and the types of activities that you engage with your communities in, as well as what you view as the strengths and needs of your organizations. We received a lot of excellent input about the types of resources you're providing to the communities and what you have planned for the future. The responses were on a very broad range of topics, and today on the call we wanted to highlight a few of the common themes that we saw. We'll also hear from Muimui Hin McCormick, Executive Director of the Connecticut Asian Pacific American Affairs Commission, who has had some recent successes in capacity building and hosting educational workshops. She'll also discuss some of the challenges her commission has faced. We want to emphasize that we realize every commission is different in their approach, and we want to use this call as a way to highlight the variety of approaches that may be helpful to others. We'll then conclude with a 30-minute question and answer discussion session.
So before we begin on the survey results, we want to remind you about the upcoming in-person roundtable meeting on May 6th here in Washington, D.C. Hopefully you have already received that invitation and are thinking about that on your calendars. Bessie would have sent that out to you last week. If you did not receive the invitation but would like to attend, please contact our intern Darren Shim and let him know so that we can be sure to add you to our list. His email should be on your screen in red. In case you don't see it, it is Darren, D-A-R-R-E-N .shim, S-H-I-M, @ed.gov. Please note that this roundtable is going to be exclusive to members of a state and local commission, and unfortunately will not be open to the public or the media. So we hope you can join us on May 6th.
First, we wanted to thank everyone for taking the time to chat with our staff to complete the survey. We heard back from 14 state and local commissions across the country, and as you can imagine, the feedback we received was across the spectrum. We'll be going over the results of our findings and highlighting some of the common key points that we had heard. As you know, the purpose of the survey was to, number 1, identify common strengths and needs and other trends, and number 2, to identify ways we can work with you as you continue to engage with your communities. We also hope that your organizations can use this information to not only learn from each other, but also find ways to collaborate with one another.
So this slide discusses commission activities, and what we found was that your commissions are involved in a variety of activities like Bessie had mentioned. In general, what we heard was that the roles range from serving as an advisory board and a convener to coordinating and leading programs to directly provide resources to the AAPI communities you serve. And a lot of this has included directly discussing priority issues, and we also heard about the efforts made to conduct legislative and policy advocacy efforts with your state governments with the hope to prioritize the community's legislative needs. We also heard about specific activities such as raising awareness among the state and local governments about AAPI issues, and these issues had ranged from small business, language access and cultural competency, Chinatown redevelopment, education, economic development, and health issues such as diabetes. Some commissions had taken an active role in leading these activities, and some had acted primarily as a convener and a connector. Now, the commissions some commissions also informed us that they play a largely responsive role on significant issues, and some want to move beyond this and have a more strategic vision, but are unsure how to proceed forward, or may lack the capacity to do so.
Let's go ahead and get into some of the common needs we heard on the calls. The greatest diversity we have seen is in funding. Budgets and funding sources are very different across all the commissions. Some commissions do have consistent funding allocated to them via the government, but many commissions operate without funding from the government and do their own fundraising. We saw budgets that range from $0 to $240,000, and operating budgets covered everything from commissioner travel to overhead to staff salaries. A majority of commissions have a need for a more consistent and sustained funding source. This is also closely related to the need for support staff with specific expertise in fundraising, grant writing, communications, outreach, and other areas.
Another need we heard about was concerning relationships. And one of the specific items that our staff had discussed on these calls with you was whether your organizations had a comprehensive community contact list that you feel is representative of all the AAPI communities in your area. Now, the feedback we received indicated that commissions are at very different stages with this. Some don't have a list. Some are in the beginning stages of compiling one. Some have lists that are largely dependent on your local commissioners who, and those will be the commissioners appointed by your governor or the legislature. And we also found that some commissions relied heavily on the network of community-based organizations. And there were a few that did indicate that they had a thorough and comprehensive list. But something that we also heard about regarding this list was that there seemed to be the common desire to expand them and ensure that not only that they are representative of all the AAPI communities in your states, but that they're organized and also centralized within your offices. Some commissions did express difficulty reaching specific immigrant and refugee populations and expressed the desire for some assistance with that. And ultimately, we received the feedback that there does seem to be a goal and interest to segment the list by different areas, such as small businesses, students, service providers, and other community organizations in order to make it more accessible and effective for your communities to use. Other commissions also identified difficulty in building relationships within all levels of the government, from state to federal, and this could be due to a lack in finding identifiable points of contact within some agencies, and there also may be a lack in AAPI staff members to connect with directly as well. And so that is something that we also noted on the survey.
The final main needs we discussed with commissions involve two key issues, language access and needs assessments. Language access and translation services are a common need across the country, and as you all know, these issues create sometimes insurmountable barriers to accessing government services and protections. Some of the commissions identified a greater need to increase the number of translated materials in order to ensure that information is accurately shared with your communities. However, many lack the funding capacity and staffing power to do so. Also, some commissions have conducted needs assessments of their community and identified specific issue areas such as language access, youth issues, or health as priorities in their work. A majority of commissions have an interest in conducting a needs assessment but lack the resources to do so. Some commissions have also expressed a desire to improve their current needs assessment practices.
And so before we move on to Connecticut's commission, we do want to emphasize that we weren't, this is just the common themes that we did here on the survey. This is not every single answer we received, but we felt that this was the key points and the most prevalent themes that we were hearing on our calls. So hopefully those were informative and helpful in terms of understanding where everyone is at. And we would also now like to go ahead and turn it over to Moy Moy Hin McCormick. She is the Executive Director of the Connecticut Asian Pacific American Affairs Commission. And again, she is going to highlight some of the success she's had in coordinating and implementing some major projects in your state.
Thank you. Good afternoon, everybody. And we definitely wanted to say thank you to the White House Initiative for allowing us to be able to present some information regarding our commission in Connecticut. To start with, our commission was created back in 2008 by Connecticut General Assembly. Unfortunately, funding wasn't actually allocated to us until probably late 2011. So we are still running into some barriers when it comes to funding some of the programs and services that our commission would like to do. On the screen, we do have programmatic highlights that I just wanted to mention. So under community outreach, we have needs assessment of Southeast Asian communities and I Speak cards. The need assessment of Southeast Asian communities was a request that our commission placed for our state government, requesting for some funding to be able to conduct a needs assessment since there hasn't been a thorough needs assessment conducted in Connecticut on any APA communities. We were able to get some funding allocated towards this needs assessment for this fiscal year, and we are currently in process of conducting the needs assessment and gathering the information. So we're looking forward to being able to have a report that we can disseminate probably sometime in June, July. Southeast Asian communities that we concentrated on are the Laotian, Vietnamese, and Cambodian, and we purposely did that knowing that we have many APA communities and not enough resources or staff to be able to conduct a needs assessment on all communities. So we figured we would start a pilot and concentrate on the Southeast Asian communities as they represent smaller populations in Connecticut, and then be able to learn from this project in addition to requesting for additional funding for future needs assessments. We are currently working on a proposal for our FY 16 and 17 so that we can request for additional funding to then address the Indian population that we have, which represents the largest APAs in Connecticut. And then hopefully the following year we'll be able to get additional funding to focus on the Chinese population, which represents the second largest in Connecticut. Second item that we have under community outreach is iSpeak cards. These are cards that our commission is able to print out in different Asian languages and distribute to community members. The concept of the card is basically, it's a business-sized card. One side is in English and the other side is in a specific Asian language. And basically what the card indicates is it tells the provider that the individual coming to them seeking services is not proficient in English and has proficiency in a specific APA language. It also reminds providers that under Title VI, that federally funded programs are required to provide interpretation services to the individual customer, client, patient without any onus or responsibility of payment coming from the individual or family. What we've been finding out from our community members is that a lot of times when they go to medical appointments, they feel an obligation that they need to provide an interpreter, and a lot of times there are no interpreters available to assist them in medical appointments or other appointments. So sometimes they'll go to appointments without any interpreter and not really know what the actual appointment is about, and they have follow-up procedures and may not be aware as to what next steps are, whether it's referrals or additional testing or what have you. Right now we have iSpeak cards in Chinese, in Laotian, and in Vietnamese. We are currently working on getting them translated in Khmer, Korean, and Karen. What we're able to do is actually reach out to our community leaders that we've developed relationships with. And these community leaders have been graciously kind with us to be able to translate the template that we created. And we indicated to them once we're able to print these out, we will, continue to and begin to distribute to community members. So we have been bringing to outreach activities that we have been participating in, or we have been directly giving community leaders a bunch of these iSpeak cards. We also have another programmatic highlight, which is considered educational, and these are legal educational workshops. We were able to complete 4 from the beginning of this fiscal year, and we are currently working on conducting another one probably in late June. Concept of legal education workshops is really about creating awareness of rights for Connecticut residents. We were able to reach out to APA professionals. Majority of them are attorneys, and they were able to donate their time to be able to participate in these workshops with us. So framework is really panel discussion where we have the experts sitting at the table doing a mini presentation on specific topics that range from immigration rights, business licensing, domestic disputes. If you are interacting with police authorities, what are you supposed to do if you get a ticket violation? And after the presentations, we give opportunity for participants to be able to ask questions and or speak directly with the presenters if they have specific situations.